Myself, Dr. Bhimanagodua Biradar from Shreya Multispecialty Hospital, Vijaypur. Today we'll speak about esophagitis and what is the mode of prevention of esophagitis and medical as well as lifestyle modification. Regarding esophagitis, it is one of the condition of inflammation of esophagus that leads to the swollen and causes the burning and difficulty in swallowing. The most common risk factors for esophagitis are usually infection, pregnancy, smoking, and obesity, even advanced aging. The habits such as like alcohol consumption, coffee, even spicy foods increases the chances of developing esophagitis. So certain medications, even including long-term antibiotic usage, radiation therapy, some chest tumors, some bad habits of taking small pills and all, that leads to the aggravating of the esophagitis. Other than drug-induced and lifestyle modification, some autoimmune diseases even that can lead to the esophagitis. There are various causes and each can lead to the different types of esophagitis. Types of esophagitis including the one is reflex esophagitis. That is the most common type. Then caused by stomach acid irritating the esophageal lining. This happens with the frequent acid refluxing or vomiting of the acid from the stomach into the esophagus. So there are another type of esophagitis which is called as esophagitis. It may occur due to the fungal infection or some viral infection. Most common in low immunity like HIV positive, immunodeficiency patients or autoimmune diseases, they leads to the even candidal esophagitis and fungal esophagitis. Symptoms of esophagitis are already, as I told, one is the throat pain, heartburning, as well as difficulty in swallowing, and mild to moderate chest pain. It may mimic like even cardiac symptoms, but you should differentiate between the cardiac and esophagitis. The possible signs, including the reflex esophagitis, are backflow of acids, food getting stuck in your throat, indigestion, vomiting sensation, nausea, as well as sometimes that severity may lead to the blood vomiting. A healthcare provider can diagnose esophagitis by looking at your symptoms. Even the patient's symptoms and signs are enough to diagnose the esophagitis. They may give your acid blocking medications to see if they help. If you feel relieved, it is like reflex esophagitis. If not, they might more test like endoscopy and endoscopic biopsy, even pH study level. That leads to you can confirm the esophagitis. For treating esophagitis, one is most important, as I told, lifestyle modification. We have to change the lifestyle modification. Risk factors like alcohol, smoking, and unnecessary analgesic, unnecessary taking medications. You can avoid these things. Along with that, the medicines including anti-blocking agents, example our Omage D, neutralizing the acidic level of the stomach. Then some anti-inflammatory, if it is a fungal origin, antifungal drugs, and these all drugs can prevent the esophagitis. You can make some lifestyle changes to help the esophagitis. For example, changing the diet plan, avoiding the food like spicy things, irritating foods, esophagitis, you can avoid those foods. Even a change in the food habit. Instead of eating a full stomach, you can go for 2-3 frequent meals, but very less quantity. You can consume a less quantity and don't drink too much water immediately after the food. So you can avoid after food at least 15 to 20 minutes. You can take plenty of water. Then don't go and sleep immediately after the dinner or food, because minimum 15 to 20 minutes your posture should be erect. Erect posture should be enough to prevent the esophagitis. You may take syrup instead of pills, whether those called as mucosal syrups and all. It will prevent the acidic formation. As far as eating is concerned, prefer, already I told, small meals, repeated meals. Then especially avoid night eating too much heavy meals, at least 3 hours before the bedtime. And habits, completely stop immediately smoking, alcohol, whatever is there. That is the most important lifestyle modification. If symptoms of esophagitis, what is the complication? Long term, if you are not treating, it may go for some mutational changes like cell irritation that leads to the esophageal cancer, carcinoma, those things can be early endoscopic biopsy, and you can treat those things. You can prevent the esophagitis. So our one of the esophageal, my practice for most common reflex esophagitis by taking analgesic, I used to give Omage D. It has one of the wonderful drug, and patients are happy, even renal safety. So I most commonly use Omage D as a antacid for esophagitis. So thank you.